Thank you very much. My name is Mr. Jake. Today we are going to study OET reading practice part B. Test 2. We are going to complete 2 questions under the test 2. We have question number 5 and question number 6. If you are new, I have old recordings. Look for it and watch. This is going to help you. Also help to promote this channel, share the videos and like the videos. My name is Mr. Jake. I'm your facilitator. We can go to the quiet room and we will solve the questions on the board together. Question number 5. In cases of snake bite, the flying doctor should be aware of. Alright, so let's go to the extract. Memo to flying doctor staff. Antivenoms for snake bite. Before starting treatment, do not wash the snake bite site. If possible, determine the type of snake by using a snake venom detection kit to test a bite site swab or, in systemic venoming, the person's urine. If venom detection is not available or has proved negative, seek advice from a poisons information center. Testing blood for venom is not reliable. Assess the degree of the venoming. Not all confirmed snake bites will result in systemic venoming. Risk varies with the species of snake. People with pre-existing renal, hepatic, cardiac or respiratory impairment and those taking anticoagulant or antiplatelet drugs may have an increased risk of serious outcome from snake bite. Children are also especially at increased risk of severe venoming because of smaller body mass and likelihood of physical activity immediately after a bite. Alright, so this memo is a policy guidelines for flying doctors on how to treat snake bite. So first of all, they don't need to wash the site, and when there's a snake bite, they can take sample from the site. Okay, so this site is like taking a blood sample, and sometimes it is not reliable. So you can also take a person's urine for systemic venoming, and when the result is negative, it proved negative, we have snake poison centers which you can call and ask for an advice. Okay, and they went on further to say that based on the type of snake, the amount of venoming in the person's body may differ. Okay, and they considered the fact that if a person has comorbidities such as renal, hepatic, cardiac, respiratory impairment, and a person also taking blood thinners like anticoagulants or antiplatelets, such people may suffer more complications or severe complications. They indicated children based on their smaller body size and their physical activity, they may also suffer a very severe complication after snake bite. Okay, so they have indicated this for flying doctor to be aware when treating snake bite. Alright, so question number 5. In cases of snake bite, the flying doctor should be aware of. Option A, where to assess specific antivenoms. Okay, so we have the information here, we'll come back to it. B, the appropriate method for wound cleaning. Alright, we come back. Then C, the patients most likely to suffer complications. Okay, so that one too, we will check it. Let's look at option A, where to assess specific antivenoms. I think this is wrong based on the point over here that the person should seek advice from a poisons information center. Okay, so it's about advice. This advice can include specific antivenoms, so it is wider than this one. This one is limited, so it makes it wrong. Okay, so A is wrong. B, the appropriate method for wound cleaning. Well, over here it is clearly indicated, do not wash the snake bite site. So we are not talking about how to clean the site or the wound, and that therefore here makes it wrong. The last one, C, the patients most likely to suffer complications. Alright, so they indicated over here that people with comorbidities, okay, like they said risk varies. So people with pre-existing renal, hepatic, cardiac or respiratory impairment. Okay, and also those taking anticoagulants and antiplatelets. They are to suffer, they have an increased risk of serious outcome from snake bite. Then also, they indicated children are also increased risk because of what they call smaller body mass and the likelihood of physical activity immediately after a bite. So this makes the C correct. Question number 6. What was the purpose of the BMTEC forum? Okay. Cleaning audits. 3 rounds of environmental cleaning audits were completed in 2013-2014. Key personnel in each facility were surveyed to assess the understanding of environmental cleaning from the perspective of Nurse Unit Manager, Environmental Services Manager, and the Director of Clinical Governance. Each facility received a report about their environmental cleaning audits and lessons learned from the surveys. Data from the 15 units were also provided to each facility for comparison purposes. The knowledge and experiences from the audits were shared at the BMTECT forum in August 2014. This forum allowed environmental services managers, cleaners, nurses, and clinical governance to discuss the application of the standards and promote new and improved cleaning practice. The second day of the forum focused on editor training and technique with the view of enhancing internal environmental cleaning auditing by the participating groups. So we can pause, think about this, paraphrase it, and then we go for the options. Okay, the best option. And when you look at it, we have 2 paragraphs. Okay, we have the first one. This talks about 3 rounds of environmental cleaning audits were completed in 2013 to 2014. So this is very specific. It means the rounds or the auditing was completed. Okay, and they discussed about some personnel that took part of it. After that, the result was shared among them to make comparisons. Okay, then the second part also goes ahead to talk about the fact that the same audit which was completed in 2014. Okay, what happened the first day, the second day? Okay, what happened? So according to them, the first cleaners, nurses, and those personnel involved, they had a chance to discuss the application of the standards and promote new and improved cleaning practice. Okay, and the second day they focus on auditor training and technique with the view of enhancing internal environmental cleaning auditing by the participating groups. Okay, that is very specific. So the first day they talk about how they discuss the standards and to promote the new improved cleaning practice, and the second day they also focus on training those who were involved how to perform internal auditing. So question number 6, what was the purpose of the BMTEC forum? Okay, so option A, to propose a new way of carrying out cleaning audits. Is this information provided to propose a new way? Okay, we will look at it. Then B, to draw conclusions from the results of cleaning audits. Did they conclude the results or something like that? Then C, to encourage more groups to undertake cleaning audits. Is there any way they encourage more groups to undertake cleaning audits? Okay, so A, when you look at it carefully, to propose a new way of cleaning, I think that is wrong, because over here they explain the days, okay, what they did. Okay, according to them, they said those involved, okay, during the first day they had what opportunity to discuss the application of the standards and promote new and improved cleaning practice. So this is different. They didn't propose, but they discussed what was already there, okay, and also how to promote it. So they didn't go there to propose something new. Then B, to draw conclusions from the results of the cleaning audit. Okay, so this sentence is quite straightforward. They said 3 rounds of environmental cleaning audits were completed in 2013 to 2014. Okay, so which means they concluded because it was completed. Do you understand? So over here we have to draw conclusions, which makes sense. Then C, to encourage more groups to undertake learning audits. Well, this is very confusing. If you look at it carefully, where they said the second day of the forum focused on auditor training. Okay, so if you look at it carefully when you read, they said for cleaning auditing by the participating groups. So it was done for the participating groups. Okay, so there was nothing like to encourage more groups. It is only those involved already who had a chance to undertake learning audits. So this one makes it wrong. Therefore, the best option is B, to draw conclusions from the result of cleaning audits. Alright, thank you for your time. Expect more recordings very soon. My name is Mr. Jake. See you. I'm your facilitator. Bye bye.